It's been said that home is where the heart is. If you provide home health care, you know there's something special about caring for people in their own homes. Developing warm and trusting relationships with patients is a natural part of the job. So is dealing with blood. Whether you are a nurse's aide, or a homemaker, caring for people in their homes can mean you are exposed to blood and body fluids and the risk of deadly diseases. Let's take a closer look at the bloodborne pathogens putting you at greatest risk on the job: hepatitis B, hepatitis C, and HIV, and what you need to do to protect yourself against them. Hepatitis B virus, or HBV, causes serious liver disease. About half of the people infected with hepatitis B have no symptoms. Those with symptoms may experience jaundice, fatigue, abdominal pain, loss of appetite, occasional nausea, or vomiting. Most people infected by HBV recover and clear the infection, but about 6% become chronically infected for life. Others die from related chronic liver disease and liver cancer linked to hepatitis B. Some are healthcare workers. The hepatitis B virus poses a greater risk to healthcare workers than either hepatitis C or HIV because it is more easily transmitted. But fortunately, hepatitis B can be prevented by completing the hepatitis B vaccine series. Hepatitis C virus, or HCV, causes a serious liver disease known as hepatitis C viral infection. This liver disease may cause symptoms similar to hepatitis B, but there are important differences between hepatitis B and hepatitis C. While up to 85% of people infected with HCV have chronic infections, only about 6% of those infected with HBV after age 5 are chronically infected. In fact, the Centers for Disease Control and Prevention, or the CDC, reports about 3.2 million people in the United States are chronically infected with the hepatitis C virus, while about 1.25 million are chronically infected with the hepatitis B virus. And remember, many people infected with these two viruses have no symptoms at all. In fact, people who are chronically infected with hepatitis C may have no symptoms for up to 30 years. Yet during that time, the infection may be slowly damaging the liver. Hepatitis C is the leading indicator for liver transplants. Unfortunately, there is no vaccine to prevent hepatitis C. However, certain approved antiviral drugs have been effective in some people who have contracted this infection. HIV attacks a person's immune system and causes it to break down. The clinical picture of HIV infection differs widely from person to person. A number of those infected remain apparently healthy for many years. The infected person becomes seriously ill when the immune system loses its ability to fight infections. Some infected persons go on to develop AIDS. In the healthcare setting, workers have been infected with HIV from needle sticks containing HIV-infected blood, or less frequently, when infected blood gets into a worker's open cut or mucous membranes. Thanks to the success of certain recent treatments, some people with HIV now live longer and healthier lives. But yet, there is no preventive vaccine against HIV. In a home healthcare setting, bloodborne pathogens, or BBPs, are most likely to be spread through contact with human blood. BBPs can also spread through contact with all body fluids, secretions, excretions except sweat, non-intact skin, and mucous membranes. They also spread through contact with other potentially infectious materials called OPIM. OPIM includes semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, saliva in dental procedures, non-intact skin or organs from living or dead humans, cell tissue or organ cultures, and other biological matter from lab experiments, as well as any other body fluid or tissue containing visible blood. Let's take a look at some of the ways you might be exposed to blood or other potentially infectious body fluids on the job. Obviously, you can expect to deal with blood if you perform or assist with medical treatment, such as changing a dressing, or if you provide oral care. If you care for a patient who has had a tracheotomy performed, blood and bloody mucosal secretions may be present. When providing urinary catheter care, you may be exposed to blood at the site of insertion or in the patient's urine. There is also a risk of exposure while bathing patients. For example, you may encounter bleeding hemorrhoids, menstrual blood, vaginal discharge, and wound drainage. It is possible to be exposed to blood even if your duties do not require you to perform direct patient care. A patient could have a sudden nosebleed or a serious fall while you are helping prepare his or her meal. When cleaning the household, you may have to dispose of bloody dressings and tissues drenched with respiratory secretions. You may encounter sharps in bed linen, on bedside tables, or in the trash. You may have to change linen soiled by blood and other body fluids. As you can see, you can be exposed to blood or potentially infectious body fluids when working in home health care, regardless of your specific responsibilities. In order to contract a bloodborne disease, the contaminated material must enter your body. This can happen if you are injured with a sharp object that is contaminated with infectious material. Sharps include not only needles, but also broken glass and anything that can pierce, puncture, or cut your skin. Infection can also enter if you have open cuts, nicks, or skin abrasions. Even dermatitis and acne can compromise the integrity of the skin barrier. You must protect the mucous membranes of your eyes, nose, or mouth because they can provide an entry for a bloodborne pathogen as well. As difficult as home care may be, just by understanding the risks you face, you are taking an important step toward protecting yourself against bloodborne diseases. The very qualities that make home health care so rewarding can also make it risky. Controlling contamination can be challenging at home. You have to plan what infection control equipment you will need ahead of time and take it with you to the work site. Hand washing facilities in the home may be inadequate and waste disposal may present a problem. It is a good idea to bring your own supply of paper towels, liquid or foam soap in a dispenser, and an alcohol-based hand rub. Use standard precautions for every client, regardless of the setting. Many people carry bloodborne diseases yet have no visible signs or symptoms. They may not even know they're infected. That means you can't always tell who has a bloodborne disease. Standard precautions combine the major features of universal precautions, which reduce the risk of transmitting bloodborne pathogens, and body substance isolation, which reduces the risk of transmitting pathogens from moist body substances. When you're assigned to a client, you should assess the situation and environment in which you'll be working. You may come in contact with blood or other potentially infectious materials, and you should talk to your supervisor about PPE or equipment you need in order to protect yourself against bloodborne hazards. You can be exposed to these viruses if a contaminated sharp punctures your skin, or if blood or OPIM splash your broken skin or mucous membranes of your eyes, nose, or mouth. The equipment you will need depends on the specific case and your responsibilities. For example, if you or any other caregiver will be giving injections, the home should contain a closable, leak-proof orange or orange-red labeled sharps disposal container. Needle stick injuries cause most of the exposures to healthcare workers. Most needle stick injuries occur when disposing of needles, cleaning up after a procedure, giving medications, drawing blood, recapping needles, or handling trash and dirty linens. Studies show that sharp safety devices may significantly reduce your risk of injury during procedures such as joining IV lines, drawing blood, injecting medications, and suturing during surgery. Your exposure control plan details sharp safety rules you should follow. Here are some general guidelines. Use a safe needle device or needleless system for withdrawal of body fluids, accessing a vein or artery, or administering medications or fluids. Also, when available, you should use either a needleless system or a needle with engineered sharps protection for any other procedure requiring needle devices. Always follow safe injection practices. Use aseptic technique to avoid contamination. Clean the environment and all objects and equipment before any invasive procedure. Remember that all needles, cannula, and syringes are sterile single-use items. Never administer medications from a syringe to multiple clients, even if you change the syringe needle or cannula. And never reuse needles, cannula, or syringes to draw up solutions for the next client. Use IV bags as well as tubing and connectors for one patient only. Then dispose according to your agency's policies. If multi-dose vials must be used, make sure the needle or cannula and syringe used to access the multi-dose vial is sterile. And never use bags or bottles of IV solution as a common source of supply for multiple patients. You will be trained in the proper use of any sharp safety devices you are required to use. You'll also help evaluate their effectiveness. When using sharps, always follow effective, safe handling techniques to prevent injury. Never shear, break, bend, or recap contaminated needles or sharps, except in cases when recapping is required by the procedure. In this case, use a resheathing device. Never reuse disposable sharps. Discard contaminated sharps immediately after use in an appropriate, puncture-resistant, color-coded container. Keep the container where it is easily accessible to you, but out of the reach of children, visitors, and pets. Do not let the container overfill. Be alert for hidden needles in waste, in linens on the floor, on shelves, tables, or beds. To reduce your risk of exposure, always wear appropriate PPE, such as gloves, goggles, gowns, face shields, resuscitation masks, or other ventilation devices. Some cases require more PPE, some less. Wear as much equipment as necessary to keep blood, body fluids, secretions, excretions, non-intact skin, and other potentially infectious materials from getting on your work clothes, street clothes, undergarments, skin, or mucous membranes. Remove PPE as soon as possible if it becomes penetrated by blood or other potentially infectious materials. Always remove it once your task is completed. Immediately dispose of used PPE according to your agency's policy. Gloves are the most basic and common type of PPE. You must wear gloves for providing direct patient care, and anytime it is reasonably anticipated that you may have contact with blood, other potentially infectious body fluids, secretions or excretions, mucous membranes, non-intact skin, or potentially contaminated intact skin. You should also wear gloves when cleaning surfaces contaminated by blood or other body fluids, including clothing, linens, or the bedside commode. Wear gloves when you pick up a waste bag that may contain blood, other body fluids, or soiled bandages. Disposable single-use gloves are used for medical procedures, while heavy-duty utility gloves are used for housekeeping duties. Since even the best gloves can be torn or punctured, cover any hand cuts you may have with bandages before being gloved. Then slip each hand into a clean glove, pulling snugly over your fingers and as far over your wrists as possible. If a glove tears, punctures, leaks, or becomes contaminated, remove it as soon as you can and discard. Then wash or decontaminate your hands depending on the exposure. Use disposable gloves only once on a single patient and then discard. Never reuse single-use gloves. Utility gloves may be decontaminated and reused if they are not damaged. If damaged in any way, throw them out. When removing gloves, be careful not to touch the outside. While both hands are gloved, peel one glove off from top to bottom and hold it in the gloved hand. With the exposed hand, peel the second glove from the top, tucking the first glove inside the second. Dispose of the entire bundle promptly in a lined waste container according to your agency's policy. Because even gloves are not 100% effective, make sure you wash or decontaminate your hands after you remove your gloves. Depending on your potential for exposure, wear a gown to protect your clothing or skin. Remove the gown and wash or decontaminate your hands before leaving the patient's environment. Never reuse gowns, even for repeated contact with the same patient. Use PPE to protect the mucous membranes of the eyes, nose, and mouth during activities that could expose you to splashes or sprays of blood, body fluids, secretions, and excretions. Protective devices and equipment help protect you against bloodborne infections. They are not foolproof. Even when equipment is used conscientiously, gloves tear and equipment fails. Work practices are specific procedures you must follow on the job to protect yourself against contact with blood or other potentially infectious materials. Most work practices are based on personal hygiene. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where there is a reasonable chance you might be exposed to blood or body fluids. It is okay to apply hand cream, but stay away from petroleum-based lubricants, which may deteriorate latex gloves. Before applying hand cream, wash or decontaminate your hands. Hand hygiene, whether hand washing or decontamination with alcohol-based hand rubs, also keeps you from transferring contamination to other areas of your body and to patients or to the environment. When you are caring for a patient in the home, use the hand washing facilities that are closest to where you will be providing care. When your hands are visibly soiled or contaminated with proteinaceous material, or visibly soiled with blood or body fluids, wash with soap and water. Also wash your hands if contact with spores such as C. difficile or Bacillus anthracis may have occurred. Always wash your hands before eating, drinking, handling contact lenses or applying makeup, after using the restroom, and especially after you cough or sneeze. For routine hand washing, use a plain non-antimicrobial soap. However, some situations may require an antimicrobial soap. If you're not sure which to use, follow your agency rules. Wash hands thoroughly for at least 15 seconds using warm water to wet the hand surface before dispensing the soap. Rub the soap vigorously over all surfaces. Rinse thoroughly under running water, shake off excess water, and dry with a paper towel. Use a dry paper towel to turn off the faucet and discard the towels in the container designated by the patient or family. For routine clinical situations or after removing visible material with soap and water, decontaminate hands using an alcohol-based hand rub. That includes between patients, after removing gloves, and when hand washing facilities are not available. Apply the product to the palm on one hand and rub your hands together, covering all hand surfaces and fingers until hands are dry. Touch waste and trash containers on the outside only. Never reach inside or push the bag down with your hands. Shake down the waste by holding the top of the bag and carry bags away from your body. Follow the same procedures when working with laundry bags. In short, treat every waste container and laundry bag as if it had a needle in it. Clean and decontaminate all contaminated surfaces according to agency policy. In general, all equipment and environmental working surfaces must be cleaned and decontaminated as soon as possible after contact with blood or other potentially infectious materials, and on a regular basis according to your agency's policy. A word about waste. Items contaminated by blood or other potentially infectious body fluids should be disposed of according to agency policy and in compliance with state and local laws. See your exposure control plan for details. Controlling infection in home healthcare takes lots of planning and preparation. Make sure you have everything you need before you leave for your home visit. You may wish to create a checklist that you can use for each visit. Include items like PPE, soap, alcohol-based hand rubs, disposable towels, and facility-approved waste bags. For each patient, know what your responsibilities are and are not. You should also know exactly what you are authorized to do in an emergency, from calling for emergency assistance to performing CPR. Always avoid unprotected mouth-to-mouth resuscitation. For patient resuscitation, a mouthpiece, resuscitation bag, and other ventilation devices are needed to prevent contact with mouth and oral secretions. If you are exposed, immediately wash the exposed area. Then report the incident to your supervisor as soon as possible within 24 hours. They will provide medical care and follow-up procedures. Report all sharps injuries as directed in your exposure control plan. Document the sharp exposure incident, including date, time, and type of sharp used. Next, evaluate the effectiveness of any safety device used and note how the injury could have been prevented if possible. Your information will be entered into the sharps injury log, where it will be used to judge the effectiveness of current sharps safety devices. Protecting yourself from bloodborne diseases on the job takes knowing the facts and taking sensible precautions. Working together with your employer, you can do it. You don't have to let concerns about bloodborne diseases come between you and the kind of personal care that can be so vital for your patients and so rewarding for you.